without further ado, I will pass it over to Dara and Ashley and let them present on the plan of safe care.
Thanks so much, Liz. Good afternoon, everyone. It's great to be here. I've had the pleasure of being in meetings with many of you before, so it's good to be back and to be with Ashley to talk about Maine's plan of safe care. I'm Dara Fruchter, the project manager for substance-exposed infants and maternal use prevention coordination. I'm on both the maternal and child health and prevention teams at the Maine CDC. And I'm going to turn it over to Ashley Olin to introduce herself.
Thank you, Dara. I am Ashley Olin. I am the project manager for the Early Childhood Comprehensive Systems Initiative currently. Prior to that, I was the Plan of Safe Care nurse for the Office of Child and Family Services, doing similar work now that I was with Plan of Safe Care, but we really want to highlight a lot of the work that we did last year in 2021 when I was in my role of Plan of Safe Care nurse. So Dara and I are familiar in working together with Plan of Safe Care presentations, and we're excited to share this information with you today.
I just want to mention before we move on to the next slide that we have included Kathy McKay's name on this slide. She's a public health nurse. She's the Cradle Me Referral System Coordinator at the Maine CDC. Unfortunately, she couldn't be with us today, but I wanted to include her name because I'm thinking that some of you over time will be collaborating with her. So thank you. Next slide, Liz. So what is a plan of safe care and who needs one? A plan of safe care is a document that is a federal mandate. All states across the nation do have to have one. In Maine, we've designed our plan of safe care to ensure the support and ongoing safety, well-being, and best possible long-term health and developmental outcomes for any infant substance exposed. And so as part of the plan of safe care, the process serves to identify needed services and resources and how to align actions to make sure that the caregivers surrounding these infants also have everything they need to ensure ongoing safety and well-being for themselves as well. State child welfare agencies nationwide are required for reporting specific data points. And so that's across the board. However, there is flexibility depending on a state's preferences around who initiates a plan of safe care. And here in Maine, as many of you know, we implemented Maine's plan of safe care on January 1st, 2021, a little over a year ago. And we are now moving into our phase 2, which we'll talk a little bit about in a few minutes. Next slide, Liz. Thank you. So the plan of safe care process is a conversation. We designed the document to provide that framework, conversation that attempts to lower and or remove barriers during the process of actually creating the plan. A conversation that often includes more than just the birthing individual, more folks than just the birthing individual, using open-ended questions, person-centered language, and being sensitive to the potentiality of stigmatizing language with which this group experiences very frequently. So again, stance of collaboration around creating a plan of safe care with a focus on strengths to begin any plan of safe care conversation. Next slide. Timeline. Very condensed timeline around our process. As I said during the first slide, we started Maine's Plan of Safe Care winter of 2021 with a lot of education and training statewide. We are moved to a conversation around creating prenatal plans of safe care, and that started happening the end of last summer and into the fall of 2021. that continues. And with the process we are really in the throes of around creating a plan of safe care online form, that form and that opportunity to create and edit the plan of safe care and maintain it as the living document that it's meant to be is really going to be a reality in this summer. We're aiming for early July 1st, 2022. And then looking ahead to 2023, we'll start talking about setting the stage for all newborns in Maine to receive a plan of safe care, regardless of substance exposure. Next slide, Liz. And now I'm going to pass it over to Ashley. Thanks so much.
Great, thank you, Dara. So many of you have seen this flowchart in the past. This is how we began our implementation of the plan of safe care, starting from the birth of the infant, moving to a hospital, creation of the plan of safe care. And really it does break down that once that substance exposed infant is notified to the Office of Child and Family Services, about 70 to 80% of those go to public health nursing. The other 20 to 30% are involved in a child protection investigation, but all are able to receive the benefits of the referrals and resources indicated on the plan of safe care. And that will be the same thing that happens in phase 2. As we know that public health nursing has begun to implement plans of safe care for all of the folks that are referred to public health nursing during the prenatal period. So if we move to the next slide, Liz, you'll be able to see that phase 2 is just a upstream version of what we did in phase 1. This time, the pregnant person is going to be identified in their prenatal office or with another provider, and that could be in a various different ways around, high social determinants of health needs. They might be identified by a talk screen or self-report for substance use. And then really this conversation begins with their prenatal provider around their substance use and the opportunity to get involved with services right away. So they discuss that Cradle Me referral to the prenatal services on what is on the whole Cradle Me form. So PHN, Maine Families, WIC, Child Development Services, and MaineMOM. And if this is a MaineMOM site, this is the same process that would work with them. So they can either refer to PHN or they can utilize the MaineMOM services at that organization. PHN will then work with that individual to create a plan of safe care in the prenatal period and connect individuals and the family to social services and health resources as early in pregnancy as possible. And as Dara mentioned, this will be via the online form starting in July. And many times with the MaineMOM sites, this could be someone working with the family in the MaineMOM process, a patient navigator, whatever that might be. So it might not be a PHN, but if they don't have someone on site, they can absolutely utilize the PHN. Either way, no matter how it's created, there's a prenatal plan of safe care that is created online with the family. And then throughout the pregnancy, that plan of safe care is updated. So if family starts to work with WIC or housing or things develop, that moves that process along and that plan of safe care can be updated online. Also, there should be a conversation at this point around the OCFS notification to child welfare and the details around this. So there's no surprises when that family arrives at the hospital. And at that point, when the birth does happen, the hospital will update that plan of safe care online with the infant information, and they'll submit the notification to OCFS once that infant is born around the substance exposed infant. And lastly, the infant provider, so the pediatrician or family practice provider and the social services will continue to update the plan of safe care online and all those referrals that may change after the infant's birth as needed until that infant is 1 year old. So if we can go to the next slide. We had a really successful first year of our plan of safe care implementation. And thanks to all of you for all your hard work. So I know that many of you here in this meeting were involved in this success. So 76% of all substance exposed infant notifications to the Office of Child and Family Services had a plan of safe care created for them. And it could have been created prenatally. It could have been created by a public health nurse, a hospital nurse. It could have been after the birth by a hospital social worker, or through a MaineMOM grant patient navigator or an OCFS caseworker. There really is not a wrong time to make a plan of safe care, as we've been saying for a long time. They've been created both for the birthing individual, also for partners and resource families. And they've really connected birthing individuals and partners to resources. And here's just below this, it's just some details around those plans of safe care, around some of the referrals that people were receiving. And it's really interesting to see that, what those most common referrals are. Most birthing families, individuals living with SUD are currently receiving financial, housing, transportation, smoking assistance, breastfeeding support, and medication assisted treatment. So if we go to the next slide, we're excited to see what happens next with the online form. So I'm going to hand it back to Dara.
Thanks, Ashley. So as I mentioned, and Ashley has been very much a part of this process. In fact, she led the process until she moved to her new and recent position. For the last year, we've been collaborating with the Maine Office of Information Technology and an outside contracted agency to develop a strategy and a plan to create this online plan of safe care form. The form will be supported by a database, and that'll be easy to access stored data and find information throughout the life of the plan of safe care. Right now, we have a paper form, as many of you know, and of course, if someone wants a paper form, they can have that. But there will be no need once we have this online piece in place. And a family will have access to their plan of safe care, a read-only access whenever they'd like to look at it and possibly think about things they want to change or update if they have an upcoming appointment with a provider, or they're of course free to reach out to a provider to make those kinds of arrangements, because the editing piece will only be done with a clinical or social services provider. Next slide, Liz. I just said that, so the form is going to be editable. And we did work very closely with teams, at the state level around HIPAA and confidentiality, and making sure that all the data is protected appropriately. We did add a few new fields to the online forms, which we'll talk more about during the educational stage once the form is ready. MaineMOM will be able to implement the online form easily across the MaineMOM sites starting in July, as I said. And again, the training on this new online form will begin in plenty of time so that people feel prepared. Next slide, Liz. Ashley, continue.
Sorry, somehow I muted myself. So this is the current form that you probably are familiar with. It will look similar, just in a different format on the online form. No big, large changes, but many of you are familiar with this process. If you're not, it really focuses the conversation around the strengths and support as the primary conversation point, and then follows up with that needed assistance and goals. And then if we go to the back side of the plan of safe care, on the next slide, we'll see all the different resources and referrals that a patient could potentially need or have currently in place. And so it really is a nice guide to a conversation and gives a nice framework around those strengths and needs. What do you have in place? What do you need? And it's really a great comprehensive list for having this conversation with families and then putting in place. And you can see that some of them might not apply when the family is in the prenatal period, and they might not be ready to have those conversations around some of them. But then as the infant is born, they're going back to work, then, oh, look, now we can talk about childcare subsidies and things like that. So it's a great conversation tool throughout the perinatal period. And if we go to the next slide, we can also access currently the Plan of Safe Care on the website. This is on the Maine CDC section under maternal child health, and you can click on any of these forms, both the Plan of Safe Care for the families, also for resource families, and then checklists for caseworkers, hospital staff, and public health nurses. And if you are Plan of Safe Care, if you are a MaineMOM site and you're going to be a patient navigator, utilizing the one for public health nurses might be the one that would be most useful to you. But, I think we're open to conversations around which form you might need and which checklist might help you the most. And so if we go to the next slide, we'll hand it back to Dara.
Thanks, Ashley. So we wanted to mention an offering that we began earlier this year. We are now gathering twice a month. Our Plan of Safe Care bi-monthly office hours are open to anyone who's interested in learning more about Maine's Plan of Safe Care, anyone who's actually currently actively creating them. It's an open forum where people are sharing ideas and concerns and successes. We will continue the Plan of Safe Care office hours as we move into and through phase 2 this year, and everyone is welcome. So it's the first and third Friday of every month from 1 to 2, and most Fridays, I'm kind of wondering if we'll even get 2 people, but most Fridays we have at least 8 or 9 or 10. So it's really been exciting for us. I will put my email in the chat because we have updated the link. So if anyone here would like to connect with me around that, I'm happy to send you an invitation, and then you'll have the link going forward. So next slide, please, Liz. So we wanted to end with talking about some of our successes. As Ashley shared earlier, we were really, really pleased when we got the numbers that earlier this year, the percentage that we shared, 76% of substance-exposed infants having a Plan of Safe Care. There was significant collaboration, both at the state level and with community partners statewide. And we were able to, because of that, that wide and deep collaboration, identify gaps and have lots of input to make this process as good as we could make it, given we were in the middle of a pandemic and there were so many changes going on for all of us. I'm going to pass it over to Ashley to talk a little bit about specifically about the incredible collaboration that we've had with MaineMOM throughout this past year as well.
Yes, thank you, Dara. So right from the beginning of the Plan of Safe Care, when we were first starting about creating a Plan of Safe Care in the state of Maine, we were really in deep collaboration with Liz and the rest of the MaineMOM team around how we could work together. We knew that this would be an important piece of what MaineMOM looked like and the supporting the families. So we really wanted to make sure our work aligned. And so that conversation continued into where we had a pilot at Midcoast, and many of you are here that participated in that, and we really appreciate that. And it really gave us some key learnings on implementing plans of safe care prenatally, and it had some really great successes. So you may have heard about that or saw the video about that at our SEI conference this fall, but that was one of our biggest successes, and just really a great opportunity that we were able to have to inform our practices moving forward. And Dara mentioning earlier the office hours, they have been very successful and a really great opportunity to learn from the folks that are implementing the plans of safe care with families. And one of the other pieces is we really like to highlight is the great success of adding child development services to include substance-exposed infants in their established conditions of risk. That really helped have an opportunity for the Cradle Me form to be utilized by CDS and to get the services to more families with substance-exposed infants in the state of Maine. So we're excited about what can happen in 2022 to kind of piggyback on these successes. And we're excited about the opportunities to increase referrals and resources for families in 2022. So we can go to the next slide, which I think takes us right to the end. And I will add that Dr. Carmack's name is there now as the medical director for any questions or comments, as I am no longer in the Plan of Safe Care role, but always happy to point you in the right direction. And I know I'll be working with many of you in the new role for referrals and resources, including the ECCS program. So just thank you so much for allowing us to be here today. Dara, do you want to add anything here in the end?
No, I think we're all set. I just want to also thank everyone for listening and for being with us today. We're so happy that we could join the presentation. Thanks.
Great. Thank you so much, Dara. Thank you, Ashley. So before we jump to Q&A, I do want to briefly go over some more logistical topic points when it comes to MaineMOM and the Plan of Safe Care. Many of you who are intimately engaged with MaineMOM and our MaineCare rule development have been following along from a service perspective. What have we learned from all of you implementing MaineMOM as a service? And over the last year and a half, there's been a lot of conversation about the requirement of MaineMOM sites in creating a Plan of Safe Care. And we've heard the information. Ashley, when she was in her role as a Plan of Safe Care nurse, we've talked a lot about the upcoming changes to the Plan of Safe Care and its current form. And so there was a lot of discussion around what could this look like in the future when MaineMOM is formally a MaineCare service. And so what I'd like to share with you is what our proposed requirements are for MaineMOM sites once MaineCare adopts MaineMOM as a part of our benefit structure, when the rules are in place for all of you as MaineMOM providers. And so the language that we are building into the MaineMOM MaineCare rule is that our MaineMOM sites ensure that a Plan of Safe Care is created for their members who are enrolled in MaineMOM, or if there is an existing plan, that it's updated at least 60 days after intake. So, so what that would look like for a mom coming in to your provider office is that during that intake period or in that 60-day window, that your team, one of your team members, would be logging into the online Plan of Safe Care system. So if we think about the timelines aligning, the MaineCare rule is being adopted around the same time as the online Plan of Safe Care system is coming live. So this is a really beautiful alignment and how we're going to ask our MaineMOM sites to be a part of this system of wrapping around mom and her infant. So we log on to the online Plan of Safe Care system, and you're looking to see if there's a Plan of Safe Care created for your patient, for the MaineMOM member. If there's no Plan of Safe Care, then you have two options in front of you as required by MaineCare. You either create a Plan of Safe Care in the online system for that patient, or you refer to public health nursing through the Cradle Me referral system. And many of you should be familiar with the Cradle Me referral system. We've talked a lot about it. If you have questions, we do have Kathy McKay here who we can kind of vet some of those questions with today. And that would help create the Plan of Safe Care. So either you do it yourself as the MaineMOM team, or you refer to public health nursing, they do the intake and they create the Plan of Safe Care for the mom. If there is a Plan of Safe Care, so let's say you're enrolling the mom in postpartum, and as we've talked about the Plan of Safe Care phase 1 implementation, all moms postpartum who gave birth to a substance-exposed infant should have a Plan of Safe Care created. So it should be one in the system when you look it up. And if there is a Plan of Safe Care in the system, MaineMOM teams are required to review and update that plan in accordance with what you're asking the mom and wrapping around and supporting the mom in her services. So does she have additional needs at the point that she's coming into your care? Does she have needs that have already been met and that you can update the plan of safe care for? That helps to facilitate coordination with other partners and providers who are supporting and wrapping around mom and the infant. The plan of safe care is not just for the mom and the pregnant person, it's also for the infant and follows the infant along as well. There's many conversations that are happening with pediatric providers, in addition to you all as outpatient women's health clinics and substance use treatment providers. So it's really something to think about as your role in the care coordination continuum in supporting mom and the infant after birth and getting access to the resources that they need. And with the online plan of safe care coming into the picture, it really is going to help create efficiencies in care coordination, communication between you as providers without having to figure it out and pick up the phone to figure out who is really supporting the person in themselves. Okay, so I just wanted to clear the air on what the rollout would look like for MaineMOM in the coming months. And we're gonna have more conversations around this implementation, but this is really to help us start thinking about, for those of you who are already doing the plan of safe care, or those that haven't yet adopted a process to do the plan of safe care, that in the future, it will be a part of our conversations when it comes to MaineMOM as a service. Okay, so that's the MaineMOM integration.